Mayor de Blasio has really drawn a line in the sand now when it comes to city workers and the COVID vaccine. His message, get the vaccine, get tested, or you don't work.
September is the pivot point of the recovery. September is when many employers are bringing back a lot of their employees. September is when school starts full strength. September is when people come back from the summer. September is when it will all happen. And so on September
all right,
13th,
you see the urgency in his voice. You hear the deadline, September. Earlier, we spoke with an employment attorney who said the mayor has every right to mandate vaccines. So joining us now is New York City Health Commissioner Dr. Dave Chokshi to tell us if we can expect to see more mandates in the near future. Doctor, thanks so much for joining us today.
Good morning.
Good morning. Nice to see you.
Absolutely. Okay, so let's get right down to it. Why such an aggressive measure? Is this necessary at this time? And is New York City losing this fight against the Delta variant?
I apologize. I'm not able to hear you properly.
Can you hear me now? Doctor, can you hear us?
Yes, there's another feed, I think, that is interfering.
Well, let me try this again. Hopefully they can work it out. My question to you is, why such aggressive measures right now? Is this necessary because New York City, is it truly losing this fight against the Delta variant?
We are concerned about the Delta variant. It is a more infectious version of the virus, and that's why we need stronger medicine in order to combat it. And so these steps are needed at this moment. And they start with our city workers, you know, the people who have been heroic helpers throughout the pandemic. Part of our mission is to ensure that both the people whom we serve are kept safe, as well as our fellow city workers.
Yeah, I know there's a feedback issue there, so we're working through it, Dr. Chokshi. Thank you as well. City workers have a little over a month to get vaccinated, and so you're offering the testing, right, for those who do not want to get the vaccine. Are you going to offer testing on site for those workers to make it a little easier as they head to work?
Implementation of this will vary a bit, you know, depending on the different work site. In some clinical settings, testing will be on site. But in general, we've made testing very widely available, not just for city workers, but for all New Yorkers. It's free and it's available, you know, in people's neighborhoods. It is very convenient already. And so we'll be relying on that testing infrastructure that we have built up over the last year.
Okay.
You know, a little over, 54% of New Yorkers have been fully vaccinated. The Bronx, Brooklyn continue to lag behind with 45% and 48% respectively. Have vaccination rates started picking up again in the wake of this Delta variant?
I'm so sorry, but there's still another feed that I'm hearing. If the technical difficulties can be resolved, then I could hear your question.
Yes, I'm sorry about these technical difficulties, Doctor. Let me see if I can try this again. Hopefully you can hear me. Basically, on the screen, we're showing that there's a difference in the percentage rates in the different boroughs of people getting vaccinated. But have you seen an uptick in the vaccinations because of the Delta variant?
We are seeing that people are coming out for vaccination. And part of their reasoning is concerned about the Delta variant. In general, you know, we have seen the daily vaccination rate start to decline in recent months, but in recent days, that has stabilized, meaning about the same number of people are coming out each day to get vaccinated. That's a good sign because it means that that decline that we had seen earlier is starting to reverse. What I really want to see is the rate start to go up again, because we still have a significant number of people who remain unvaccinated, and that's what we'll follow in the coming days.
Yeah. Dr. Chokshi, can you hear me okay? I know we're still working out these issues here. Can you hear me?
Yes, I can now.
Okay. All right, Dr. Chokshi, let's talk about this right now, because there's a lot of talk for people at home. They're hearing this term breakthrough case, right? And they're wondering if they're vaccinated, how susceptible they are with these breakthrough cases. If you come in contact, you're fully vaccinated, you come in contact with someone who now has the virus, do you have to quarantine? What is the procedures now in terms of this new kind of wave that we're facing?
Yes, this is an important question. The bottom line is that if you are fully vaccinated, you continue to have strong protection against the virus, particularly against the severe outcomes of the virus. That means hospitalization and death. We are seeing a slightly higher rate of breakthrough infection, but that's not translating into breakthrough disease. The outcomes ones that we are most concerned about. So with respect to your question, in terms of what someone who is fully vaccinated needs to do, if you encounter someone, who has had COVID-19, if you're exposed to them, it's not recommended that you quarantine or test unless you develop symptoms. If you develop symptoms, then those steps are necessary and you should get tested immediately. The other thing that I'll add is that, of course, there are steps, if people want to take additional measures to protect themselves, fully vaccinated can certainly ensure that they're spending more time with other people who are fully vaccinated. That's perhaps the greatest safeguard that we have, because we know that really tamps down on the spread of the virus. And beyond that, the things that we've used, the tools that we've had during the entire pandemic, masking, distancing, and keeping your hands clean, those remain very important as well. They're most important for people who remain unvaccinated, but certainly there are added layers of protection for everyone.
Absolutely, and we can't forget about the children who cannot get vaccinated at this point, and we do have to take extra precautions for them as well. Dr. Dave Chokshi, thanks so much for being with us today. We appreciate it. Sorry about those technical difficulties, but you hung in there, and we appreciate your good information.
Of course, no problem, and thank you for having me.
Absolutely.